What's up, guys? This is Dr. Mo Muhammad Ashori, MD, family medicine doctor at Digital Nomad Health. So today I thought I would spend just a few minutes talking about a great book, Everything You Hoped You Never, wait, Everything You Hoped You'd Never Need to Know About Colorectal Cancer, a doctor's very personal guide to getting through the shit and beyond, Dr. Anisha Patel. So I wanted to talk about this book because it's actually great. It's actually a really wonderfully written book, and I think it's going to be a lot of help to many of you. I'm actually trying to figure out how I came across it. That's right. So this was at the library. This is one of the books, two of the books I picked up at the library. And what is great about books like this is they are written by physicians who end up having their own health issue, right? So doctors are patients, and some patients are doctors. And when you as a physician end up having an experience, you get to experience the medical system in which you work from a patient's perspective, which is very unique and completely different. What I really loved about this book is this physician shared her story about getting colorectal cancer at a very young age and having a type of procedure that is kind of not invasive, but traumatic in some ways. And she talks about her entire journey through that, and she breaks up the chapters really easily. It's a little bit of a dense book, but not too bad. And she shares some of her journal entries in there, which is really good. And obviously she had a good outcome. The back of it says "Fit Doc, Bum Deal," which is cute. Yeah, the reason I like books like this, and I recommend it to my patients, is because it's good to know what a journey like this, a health emergency, a health crisis, might feel like. What would it feel like to get cancer? And what might it look like for you? What I've heard many times is cancer will always be a unique experience for every single patient. You can never prepare for it. You can never anticipate how you're going to react. You might even say, I would never get chemo, I would never get surgery, I would never get radiation. But you owe it to yourself to be open to how you really might react when or if that time ever comes. So I wholeheartedly would recommend this book. It's just a great read to understand what the process is like, from scanxiety to how to navigate your sex life after you get pelvic radiation. And I would also say, for those of you who are listening to this, who are following me at Digital Nomad Health, that cancer screening is a tough topic. It's a tough topic because we have some screening tools available to us. We can do prostate cancer screening, we can do cervical cancer screening, mammography, colorectal cancer, maybe a little bit of lung cancer screening with CTs, but that's it. So the majority of cancers still remain we don't have the ability to test for them in mainstream or traditional ways. But remember that what's mainstream and traditional is not always what's available to us in medicine. For certain people, doing liquid biopsies could make sense if you're at very high risk for certain cancers. For others, doing whole body MRIs could make sense. For most of us, unfortunately, it sounds like it wouldn't be, because you're going to find things that you didn't want to find, and it's going to be misleading in other ways as well. So it's a good discussion to have with your own physician, somebody who knows you, somebody who's gotten to know you over the past few years, understands you, understands your risk factors, right? That's probably one of the most important things. If you can have a really proper risk assessment for, are you at risk for colon cancer? And if so, then you can choose the right tool to test for it. For example, it makes very little sense to do a FIT test or a fecal globin test, any of the test kits available for stool-based cancer screening, for somebody who you highly suspect is having active cancer. You wouldn't do that. You would do an actual colonoscopy. It's the same thing for somebody who you suspect has a very high risk for colon cancer. You wouldn't just wait and do it at age 45 or 50 or whatever the recommendation might be in your country. You're going to do it quite early, and you might even do it at your own annual rate. For colon cancer, for example, in the US, it's every 10 years. But you might say, no, we're going to do it every 3 years, based on some genetic testing of the person or based on their family history. And it's also important to understand that just because you follow the standard protocols of mammography or prostate cancer screening doesn't mean that you're going to catch it early enough, right? And it also doesn't mean that you're going to catch the right cancers. As we always say, with cancer. There are the turtle cancers and there are the hair cancers. The story of the turtle and the hair obviously being that one moves very slowly and one moves very rapidly, but in the end, of course, they all lead to the same outcome. If you have the kind of cancer that may have even disappeared, many of us right now, me, as I'm sitting here, there's probably some cancer brewing in me, right? We know that many of us will end up having cancer. Many of us will end up dying of something else, but there was maybe cancer in our body without any issues. The question is, how slowly is this cancer moving in my body? And if I catch it and treat it and get rid of it, just because I survived and lived, does that mean that I really treated a hair cancer, a very rapidly growing cancer that would have probably killed me? Or did I treat a turtle cancer that would have maybe grown, maybe regressed on its own? I would have never even noticed it. Or maybe wouldn't have done anything, even if it had metastasized, it probably wasn't strong enough to do anything in me. Who knows? The point is not to scare anyone, by the way, with these kind of videos. The point is to educate you and to get you to appreciate the importance of building that one-on-one relationship with your doctor, having that discussion based on your risk factors and what your health goals might be. Once you can figure that out, you can design a really good individualized plan to come up with your cancer screening protocol. And in the meantime, definitely check this book out. She's from the UK, by the way, so she talks about the NHS, and it's kind of interesting to actually learn about how things are done at the NHS. But her experience dealing with colon cancer, I think, definitely applies to anybody in any country. If you have any questions, go to digitalnomadhealth.com. You can reach me there. Take care.